Welcome to Medical Ocean. Today our topic is universal hospital codes. There are mainly commonly universal codes are used in hospital for us: blue, black, greens, gray, and yellow. These five codes are used in hospital is color wise about the different emergencies. If you have different emergencies, we use different codes. We will explain one by one codes accordingly, but don't skip the videos. At the ends there are some signs for these codes which is important for you in hospital as well. You should know the two things: colors and name of the codes. First, we will discuss blue codes. This is the most well-known codes that sign a medical emergency, such as cardiac arrest. Code gray. This code is used to alert staff members for combative or violence patient that requires immediate interventions. These two codes are used for different emergencies. One is for arrest and second one is violence. The next code, browns and yellow. Brown code is used in hospital to indicate a situations in which there is a hazard spell. Hazard spells. Code yellow. This code indicates a situation in which a patient or visitor is missing or lost. This is two different emergency. One is for hazard spells, the another is for indications someone is missing or lost in hospitals. So brown is used for hazard spells and yellow is used for patients, visitors, or someone who is missing or lost. The next one is yellow. The code is indicate situations in which the patient visitor is missing. You know already about this. So code green. This code is called when an external disaster such as tornado or hurricanes affect the hospital. Some disaster where the hospital is near to the rivers or sea, the disaster schemes in hospital, we should use code green. So the next one is code black. This code is called when there is a bomb threat or a suspicious package in the hospitals. Means some bomb blast or suspicious arrest came over hospitals and they wants to bomb blast at hospital or near to the hospital. There we can use black codes package in hospital. So you should know about these all codes. Remember these five codes and remember the different emergency regarding list because this is universal. And further we will discuss more which are used in different hospital and different categories. They have a lot of 10s we can use now later on in these videos. The one code blue, medical emergencies such as cardiac arrest, you know about this. Code red, fire or smoke emergency. If there is fire or smoke, you should use code red. Code gray, combative or violence patient make a violence with nurses, doctors and others. Code brown, hazard spells. Code yellow, patient or visitor are missing. Code pink, infant or child abductions. Code orange, mass casualty or disasters. Code green, external disaster that affect the hospitals. Code black, bomb threat or suspicious package in the hospital. These are different codes and you should use different example in these codes. So remember the different MCQs came from these code in your papers. So you should remember that code blue is used for cardiac arrest, medical emergency. Don't be confused in these. Code red. Red is fire is red. When you can smoke, it's make a fire. So both are fire. Red fire and red codes is used for fire or smoke emergency. Gray codes, combative violence with patients. Gray means violence with patients. Code brown, hazard spells. Brown, you should know about it. Code yellow, patient or visitor is missing. Yellow means patients, visitors, anyone who can missing during hospitals. Code pinks, infant or child abductions. Infant or child abductions. Orange, mass casualties. Mass casualty means a lot of casualties during floods, disasters, or road traffic accidents and others disaster. And now code Green code is used for external disaster that affect the hospital. External disaster that affect the hospital means some hospital is near to rivers or other which affect the hospital, earthquake or something else. Cold lakes, bomb blasts, suspicious package of hospitals. If an MCQs came that there is a bomb blast entered to a place, which code you can use? We can use, of course, code black. Therefore, if a patient is cardiac arrest, which code we use? Code blue. If the patient is smoking and suddenly you can saw the patient, which code you can use? Code red. This is different codes you should keep in mind which code is used for which emergency. This is a small picture. You should know about this picture. You should can learn from this picture, and another picture we can use sign as well. The one is black, bomb blasts are suspicious. The one is you can show the search things on this image. This is suspicious object for you can. Blue, cardiac arrest, you can see the ECG sign on this. Browns, chemical spill, hazard materials, hazard sign is near to this. Gray, shelter in place, ear escalations, you can see in the sign as well. Green, evocation, you can see the sign. Orange, mass casualties, you can see the stretchers sign in these as well. You can remember the two things. Sign for hospital, when you are at some hospital you can know about the sign that this sign is used for this purpose, and for MCQs and for your learning you can treat know about the each and everything that if you can chemical spills, you should know about that this one is brown. Cardiac arrest and cardiac emergency is blue. Bomb blast or bomb threat, yes, suspicious object is black. Mass casualty, you know about it, it's which one? Mass casualty is orange, and the stretcher sign is for casualties, and evocation is the next sign, the person who is running outsides. And gray shelter piece are ear exclusions, is a bottles where is above the bottle is ear signs, and brown is the hazard signs, you know about this. The sign is hazard or dangerous chemical signs. Blue, ECG signs, cardiac emergency. Black is searching signs that you know or you want to search some things which is missing or which is suspicious. And sometimes the people say that suspicious came over there, you can search the people, you can search the things like that. This one is this. So keep in mind, this is most important for your paper and OSCE, so you should know about this in good hospital. The pink one is, you know, pediatric emergency, the peds sign is there. Purple, medical emergency other than cardiac arrest, it's medical emergency but not only cardiac arrest, because the sign for cardiac arrest you use that this there was is ECG sign, and now here is the sign of medicals. Red means fire, smoke or fire, you know about it, and previously you can study as well. This white, violence, aggressive, violence, yeah, aggressive. Yellow, missing person, someone is missing. The missing person sign is, you know, that the two are present and one is missing. White means violence, fight between the two persons, yeah, that is oral violence, that is physical violence, that is abuse violence, multiple types of violence then, but you should know about these signs and these are. Thank you so much. Subscribe this channel. Thank you very much.